Good morning, everyone. My name is Buffy Lloyd-Krejci, and I am super excited to be here today with you to share some of what I have learned in the long-term care facility healthcare setting. And my talk today is going to be on improving the quality of the National Healthcare and Safety Network data, and of course, my experience. So the objectives today are to apply the knowledge that's been learned from the Centers for Medicare and Medicaid Services, CMS, and the Centers for Disease Control and Prevention, the CDC's pilot project, to support accurate data reporting. I'm going to describe the common Clostridium difficile data reporting errors in NHSN that I have had the experience with in the long-term care setting. And then I want to demonstrate to you some tips and tricks to gathering your surveillance data and some collection strategies. And finally, because we're all in this together and we all need help, I want to share with you some national educational resources. So I want to talk about this a little bit. We discussed this on Monday, and Dr. Bell had described to you the insurge of enrollment into NHSN, and that a lot of this has been due to the CMS QuINQ-IO pilot project. And so what I want to demonstrate here is that, there was 130 long-term care facilities that enrolled into NHSN just about a year into the availability of it. And then a little bit later in June of 2016, so 3 years later, there was about 307. So there was actually, some of this was due to, I believe there were 2 states that were mandated, and so that helped with that increase. And then you can see the large spike in April of 2017, and then now currently in March 2018, the actual number of enrolled long-term care facilities is over 3,000, which accounts for about 21% of the long-term care facilities in the nation. And I just want to take this opportunity to congratulate you in all of your effort and work, and who have the long-term care facilities who have enrolled and who have done this work, as well as the QuINQ-IOs and the partners that have assisted you. So I just want to do a round of applause and thank you guys so much for this effort. This was definitely and has been a labor of love, and the work continues to move forward, and just really grateful for that. In addition to long-term care enrollment, NHSN has over 7,000 hospitals enrolled that include 531 LTACs. There's over 5,000 ambulatory surgical centers, over 7,000 outpatient hemodialysis facilities, and then now the 3,200 long-term care facilities. And so that accounts for about 23,000 healthcare facilities that are enrolled into NHSN. And the reason I bring this up is because it shows that this is a nationally recognized surveillance system, and it's really important to utilize in order to capture infections and to begin tracking and then preventing them. So as wonderful as this is, I wanted to say that we have approximately 12,000 nursing homes remaining that need to enroll into NHSN. And what this means is that there's a gap. And this gap is we don't fully understand the disease burden in these healthcare settings. And so when we're talking about the continuum of care, we're lacking a huge portion of our knowledge. And so I hope my presentation today is about data quality and how to gather variables and some easier ways to do that. But I'm a cheerleader for NHSN, and so I hope that if you're not enrolled into NHSN that you will enroll, and to know that there are resources available to assist you with that. So some of the lessons that were learned or have been learned and continue to be learned within this pilot project is there's a steep learning curve. This is not an easy task to take on, and many of you who are in the long-term care facility, you came into your role as a nurse, in the clinical role, and the last thing you even thought of was, I'm going to be doing what? Surveillance? Data? No. So going through the SAMS process, definitely a learning curve. So my encouragement is to be patient with the process, be patient with your colleagues that are going through the process, and really support each other. So I know we're all busy, but I would like to take my hat off to you folks that work in long-term care and say you probably are the busiest. I wish I had a tape recorder. Well, we don't have tape recorders anymore. I wish I had a recording of some of the phone conversations that I've had with the long-term care when I was assisting with enrollment. I'd be like, I just need 5 minutes to help you get through the agreement to, the rules of behavior, and they're like, I don't have 5 minutes. I'm like, just 5 minutes, and they would have, I'd hear residents, in the background, I'd hear alarms going off, phones ringing, and so, I'm asking them to stop and do the SAMS process, but so definitely we appreciate the time that goes into this and acknowledge your workload and acknowledge the work burden that you have, and hopefully we can partner with you and make this less burdensome for you. So in addition, one size does not fit all for training materials. There are a lot of excellent training materials. Of course, NHSN, the Quinn QIOs have excellent resources, and even your state health departments. And so I really encourage you to really identify the training materials that work best for you and utilize them, and just see what works best. And then also, what we've learned too is we absolutely cannot do this alone, and it's absolutely necessary to partner and utilize national, state, and local resources. So some of my experience working with NHSN, I actually began working as an analyst on the acute care side, creating reports for hospitals and NHSN data, and I was sharing with a colleague, I think it was last night, how, to me, I always really liked NHSN data. I thought that it was actually pretty user-friendly, the actual data. And what I really appreciated about it was the ability to generate reports right away. And so it actually does a lot of calculations for you. So that's a real benefit to NHSN. In 2016 and 2017, I participated in assisting with the Quinn QIO in enrolling facilities across the country into NHSN to obtain the SAMS card to become SAMified. That definitely was a big project. We learned a lot along the way. We learned how we can support the nursing home facilities in that. Through that process, that the enrollment process included the completion of the NHSN annual survey, as well as setting up the facilities, locations, and adding users. And I'll just put a plug in here. We always need more users for NHSN. We always need those backup users. So in 2017 was the baseline time period for the pilot project from March of 2017 through December, and there was 10 months of data that was collected during that time period. And this was when I really had the opportunity to dive into the data as the data was being submitted by the participants of the pilot study. I was able to, along with my colleagues, go in and really see what the data was showing. And this is kind of where it was like, oh, I'm not sure if they should have reported that, or, it just kind of looked like, okay, there's some opportunities for growth and learning and education in surveillance definitions. And that's a lot of what I'll be talking about today. And then this year, to me, is the most exciting. It's the post-baseline intervention. It, is the continuation. The nursing homes continue to report their data every month, and to me, this is where it's all at. So you've collected data, you have a baseline, and now you can use that data to drive your infection prevention and antibiotic stewardship programs. And so hopefully the nursing homes are really incorporating that into their workflow and being able to see how this surveillance program isn't just about collecting data, it's really about driving infection prevention. And so today I'm talking about the accurate CDI data surveillance. So I like to bring you to this page. It's been shown throughout this training, and I can't reinforce it enough. It's really really important to download these table of instructions for your event and your summary and your monthly reporting plan. This, definitely have this bookmark on your web browser, and also, download and print these forms as you're learning the surveillance, even if you know it inside and out. I have these forms printed out because there's always questions, there's always things that I'm not really necessarily sure about, and so it's a great reminder what exactly the surveillance definitions are. And what has been described already is that the surveillance definitions are different sometimes than the clinical, and so we always want to make sure that we're matching with the NHSN surveillance definitions. Now, if you forget everything that I say in my talk today, which I don't think you will, there are some great YouTube training videos. Health Services Advisory Group has created these wonderful training videos, and there is actually one on the common C. difficile data reporting errors. So feel free to check out these videos, and this can assist you on your own time, and you can pause it and then go through it as you need to. So as Dr. Antilla had described, this is the best practice checklist for entering data into NHSN. First, you want to always have your monthly reporting plan updated and completed and updated as necessary. And then you'll enter your events, whether they're lab ID or UTI. And then you'll enter your monthly summary data and resolve alerts if they're applicable. So today we're going to go through some of the common errors that I have experienced and seen in NHSN with the reporting plan, the events, and the summary data. We're also going to go through, in this order, also include the annual survey with that. So before we dive into the data, I wanted to bring this up. I want to have a quick demonstration on how to log into SAMS, because this comes up all the time for me. I get people saying, I have to log into SAMS twice. I enter my username and password, and then I end up having to do it again. And so I thought, well, this is a great opportunity to, a really quick tip here. So when you come to the SAMS login page, you choose the login options. A lot of times you're going to want to immediately type in your username and password. I did this. This is a common. You have a username and password to type in, and so this is where you do it. But where you're actually supposed to go is the SAMS grid card, and that's because this is the level of credentials that you need in order to get into NHSN. So you click on that login, and then it'll actually take you to where you enter your username and password and the SAMS grid card credentials. If you do it the other way, like I said, what will happen is you'll enter your username and password, and it'll take you to NHSN reporting. When you click on NHSN reporting, it'll loop you back, and you'll have to enter your username and password again. So this, if you enter it this way, this just reduces one more opportunity for error and frustration too for you. Okay, so let's go into some of the common data errors that I have found with working with users in NHSN. So the NHSN survey, one of the common problems is not really understanding or knowing the primary testing method for C. difficile, and oftentimes we've seen it inaccurately reported. We would pull reports and actually look to see, based on the CDC's recommendation, we would look for those that were reported as other or also for toxiculture. And so we identified this quite early. And the problem with this is that you want to make, or the importance of it rather, is that you want to make sure you have the accurate laboratory, as this is going to be hopefully moving towards the risk-adjusted models. I know that Dr. Bell had talked about that on Monday as far as this being part of the risk-adjusted models. And so this is really important to capture the accurate laboratory. And also you want to do that because the different tests have different sensitivities. And so you want to make sure that you know the right one and you have that entered. So you can go into your surveys, and here I have 2017. And so this is an example where the the user maybe selected other, and oftentimes what we've seen is that they'll have other and then PCR written in the comments, and so that's kind of an indication that it's wrong. And you can see here that the nucleic acid amplification test, or NAAT, is actually an option with PCR. One thing I do want to draw your attention to is that the option below that is also NAAT, but that's with the EIA, and that's the two-step algorithm, and so you'll want to be clear on to which test you're actually using. So if you have put other or toxigenic culture, then you can edit and then make that change. So you would scroll to the bottom and click Edit. And then you would select the appropriate test. Here I have selected the NAAT plus EIA, which is actually becoming more popular in healthcare settings. And so it doesn't matter. This was just the one I selected. But you'll select your correct laboratory test, and then you'll save it. If you don't know what laboratory test that you need to use, you can contact your laboratory and ask them, and they'll be able to provide that information for you. It's good for you to know too, and while you're talking to your laboratory, I encourage you to actually ask them also if they have a policy in place that where they don't accept C. difficile if they're formed stool. So that is another criteria that's important to know too, because you want to make sure that they're accepting the appropriate laboratory specimens for C. difficile testing as well. And then that's saved. So for the NHSN monthly reporting plan, we've heard about this a lot in this training, and I think it said if you have to learn something 7 times before it sticks, so maybe this is the 7th time, I don't know. But we've learned a lot about it, so that's great. Always I can have some refreshers and learn more about this. So talk a little bit about the monthly reporting plan, and just as a reminder, this is required every month. I have had users that will call me and say, I'm trying to enter my data, it won't let me. And one of the first things I ask is, did you fill out that monthly reporting plan? And so that's a common something that can be missed. And so you want to make sure to fill that out every month, and you can fill it out 12 months in advance within that consecutive month. You know, you definitely have that option. One of the things that may be suggested is to get in that routine of filling it out every month, so when the next year comes, you don't forget about it, because we've seen that happen as well when when users have filled it out for 12 months in advance, and then the next year rolls around and they're like, I can't enter my data, and they had forgotten because it had been a year. So if you're a new user, you might want to just get into the habit of filling that out every month until you're really used to that. So one of the common problems that we've seen is that there's extra reporting modules are selected, and the user doesn't intend to actually conduct surveillance and report on those modules. And so the importance of that is that you're agreeing to NHSN that you're going to conduct surveillance for 6 months for that module, and you want to make sure that you have accurate data in there for that time period, and if you're actually not conducting surveillance, it could potentially lead to inaccurate data reporting. So you remember that we agree to conduct surveillance for the 6 consecutive months, and that's because it is to help provide meaningful use. So what I've seen is where facilities have selected potentially, like they're only doing C. difficile, but then they select UTI, or even because they said, well, we collect information on UTI, or we do the hand hygiene and gown and glove use, but they don't really intend to do surveillance on it. And so what happens is then they see, when they go to enter their summary data, they realize they need to enter numerator data for these other modules, and they're not collecting it. And so what we've seen is that some people have entered like all zeros, and so that just, it's just not putting in clean data. And so you're going to want to make sure that you're only checking those modules that you're actually conducting surveillance and reporting data for. And so here, I'll go through an example of how you can modify that. You can go to your reporting plan here at the navigation bar, and you can click Find. And then here I've selected January 2018. So you see here that I have selected, let's just say the scenarios CRE and UTI by mistake, because in my facility I do look at this data, but I don't really want to or have the means to conduct surveillance at this time. And so if this is the scenario and you choose to modify this monthly reporting plan, you can. So you would find the monthly reporting plan and click edit and then save your changes. The only caveat to this, as has been described, is that if you already have a summary report created or even monthly event data, then you'd have to delete that data in order to change your monthly reporting plan. So let's say you want to do that. And so say you go to edit your monthly reporting plan, this is the actual error that will come up. And I've had people call me and say, I'm getting this really big error, I don't know what it means. And basically this is saying that you can't change your monthly reporting plan because you have summary data. And so if you do decide that you want to change it, then you can go into the summary data and click find. And I just want to demonstrate to you what this looks like. So you see here that we're actually collecting data on the CRE as well as the UTI and C. diff. So you'd be required to enter all of this data, the numerator data, for those modules. And you've decided that you want to change your monthly reporting plan, and so you're going to delete the summary data. Now, if you've been doing this for a long time, I'm not suggesting or saying you need to go in and delete this data. In fact, if you do decide to do this, I say do it very cautiously. You want to make sure you save your information, write it down, and then immediately once you've modified your monthly reporting plan to put the summary data back in. It's really more for you moving forward to really know that you can modify your reporting plan and to help you have cleaner data. So then you could delete it, and then you can go to your monthly reporting plan and select find, and you can then edit, and then you can see here I've deselected the UTI and the CRE is gone. And so now it's saying I'm agreeing to conduct surveillance for 6 months only on C. difficile, and then go ahead and save that. So that's if you want to modify your monthly reporting plan. And then if you did delete your summary data, go right back in and add. And you'll see here now that the only module that I have to report is for C. difficile. The UTI and CRE are now removed, and you can enter your denominator data. Okay, so for monthly CDI event, we've heard a lot about that. We did some great case scenarios yesterday. Again, I want to take you to the data collection forms. I encourage you to print these out and utilize them in your daily collection of CDI events. This is going to help you when you go to enter your data in at the end of the month, and you'll have everything in one place. The forms are customizable. They are in Word as well as PDF, so you have those options. And remember that only results from unformed or loose stool specimens conforming to the shape of the container should be included in CDI Lab ID event surveillance and reporting. I don't have a cool picture like Angela did, but that's a good reminder. So the first problem that has been seen with the monthly CDI events is that the user will create an event for a resident that was admitted on CDI treatment. Now, we learned yesterday this is a possibility for reoccurring C. diff, but what I'm referring to here is when the resident actually comes into your facility right away and they're admitted with C. diff. And what happens is sometimes the user thinks that they need to create an event for that incoming C. difficile. And so the importance of this is that if you do that, you're actually creating duplication, so you would be counting it in your summary data as well as an event. That's going to inflate your rates of C. diff, as well as affect your national, state, and local facility level rates. So you want to make sure that you're only either creating an event for it or entering it into your summary data if appropriate. And so this is the event, and you can see here that the date of current admission to the facility is March 1st. And this is the call that I've received. So I get a call saying, Buffy, I'm trying to enter in the date of event. They had C. diff before they came to the facility, but the system won't allow me to enter in the date before they got here. And they're trying to put in February of 2017. Actually, a lot of times I hear, I don't even know when they were tested, but I want to put in before. And so they'll get this validation error. So if you're trying to put in a CDI event and you get this validation error, whoops, we don't want that, right? Okay, if you get this validation error, it's potentially because you're putting in the wrong, you may not even be needing to create an event. It could just because you accidentally put in the wrong date as well. So then you would select OK. And then what we've also seen is that here the date of the current admission is 3/1, and then the date of event, they're like, well, I can't put it in before, so I'm going to trick the system, and I'm just going to put in the day they were admitted. And so we've seen that too. Pardon. And so then what has caught our attention with this is we were going in and looking at these events, really looking at line by line to making sure the data is accurate. We'd see these comments that said the resident was taking Flagyl to treat C. diff infection. This is just an example, but I'd be like, oh, maybe they were actually admitted on it. Because it is a possibility that you can test the first day of admission and they can become, that they truly are positive for C. diff the first day that they were admitted to your facility. So that is possible, but in this scenario, the user was actually incorrectly adding an event. So if this is the scenario, you're going to want to actually delete this C. diff event. And then I put this in here that you don't create a CDI event for resident admitted or readmitted on C. diff treatment. This is only, this does occur if they're reoccurrent, like what was discussed yesterday. So if it's later on in their stay, then that's okay. But I'm talking about when they first get to your facility and are admitted with C. diff. Okay, so the second action is, the action for this actually is that this particular event, it's not an event, it would actually be added to your summary data. So that's where this would go. And you want to make sure that you have that accurate count. So it's easier for you too. You don't have to create an event when they're admitted on it. It's going to save you some time. Okay, so the second reporting error that has been commonly identified, like I said, we go like line by line through this, so we really would look at the common, errors that we were seeing. And it's that when a resident was transferred from an acute care facility within 4 weeks, there's a question that asks, was the resident taking an antibiotic for this organism type? And then oftentimes we'd see the Y for yes. And it was happening a lot, so we were curious, like, is everybody being admitted on C. diff? Like, this doesn't make sense. And so the importance of this is we don't want to misrepresent the number of residents on antibiotic therapy for C. diff, as well as this can affect your infection prevention strategies. So we looked a little bit closer at this, and even I remember looking at being like, it's this specific organism type. So it is saying, was the resident on C. diff treatment, basically. And again, this can be yes if they were admitted, later on you tested and they were admitted on that treatment for C. diff, if it's a reoccurrence of C. diff. But that wasn't really what was happening. If they were on any antibiotic is when they would select yes, is what we were identifying, and be like, oh no, the resident was on something else. And again, the comment sections would be like they were admitted on Cipro or some other antibiotic, and be like, okay, so maybe that's what they were referring to. So if your resident was admitted on another antibiotic, then you're going to want to select no for this question. You'll edit it and select no for that. I want to add here that when you fill out the comments section, super, super helpful. It really helps the CDC and QuinnQIOs to dive deeper into the data, and it's really beneficial. It's really interesting too, because we learn a lot about the residents that have reoccurrence, or if there's maybe something happening. I've seen comments that say, oh, we've got like a cluster going on in this unit. So they're very interesting. So I definitely encourage you to continue adding those comments. It can help with those who are supporting you in data entry. And then you can save that. So the third area I want to talk about is the monthly summary report. And so we all have talked a lot about this summary report, and the first one I'll talk about is that the number of residents on CDI treatment are incorrectly added. So this is the actual inverse of what I was talking about in the first scenario, where the user thinks that it's really just a case of over-reporting, where the user thinks that if a resident if they created an event for a user, that they also have to add it to their summary data. So it's just really important to distinguish those, that if you test for it, then you're going to create an event for it. If it came in from another facility, then you'll be able to add this into your summary data. And again, the importance is that you don't want to over-report the residents admitted on CDI treatment, because this is going to affect your admittance with CDI prevalence. And this is really important because when you do NHSN analysis, you can actually pull a report that shows the prevalence on admission. And by drilling down and looking at that, you can see the risk that your other residents are being put at based on the number and the percentage of the residents being admitted with C. difficile. And so you don't want this to be super high if it's really not. And this really came to my attention once I was looking at a report, and it showed like 1 month maybe they had 1 or 2 admitted on C. diff, and then the next month they had like 6 or 7. And I said, did you really admit 6 or this many more on C. diff treatment? They're like, no, we had 3 in-house. I'm like, okay, so we want to create we want to create an event for those, and then add the ones that actually came in on C. difficile. We want to report those in the summary data. That can kind of allude to some of the variance that is seen in the data too. With some of our outliers, is just some of this inaccurate reporting and summary and event data. So if this is the scenario, this is what I'm referring to as the number of admissions on C. diff treatment. So for the action of this is you're going to report only residents who were admitted and or readmitted and taking antibiotics specifically for their C. difficile infection. It does not include residents that were tested and confirmed positive within your long-term care facility, excluding the outpatient criteria, unless, like we have shared, it's a reoccurrence later on in their stay, because that's a possibility. And then also, review your monthly admissions to determine who was admitted on C. difficile, versus those that were tested in your facility. And so a lot of times we'll hear that they were tested in-house versus they came from the facility. The second common reporting error for the summary data is the no lab ID events box not being checked. We've talked a lot about this, and I know we're in the month of July, and I think there's something called like Christmas in July. And so my Christmas wish list to NHSN is that there be a hard stop. If somebody needs to click that box or check that box and they don't, that there would be a hard stop and they can't even save the summary. So that's my wish list for Christmas this year. And what happens, and this was an interesting find for me. So we knew that, people just forgot to enter it because sometimes, they wouldn't remember, and it's just one of those things you have to learn. But the importance of this is that if you don't check this box, then your summary data is not saved. And so, and it'll create an alert. So I was working with a user, and I was sitting with her, and we actually were entering in the data, the summary data. We entered in all the denominator data, and then we clicked Save, and then we got an alert. I'm like, what? I've done this 100 times. I know how to do this. Like, what is wrong? And pardon, what happened was that she was working on a really small monitor, and neither one of us even saw that checkbox. And so what you can do, you can actually go into the alert. I learned this yesterday. I didn't know this. You can actually go in there and click the hyperlink, and it'll actually be right there for you. So that's a good tip now to know, too, is that in the alert, you can actually just check that box. So that's good to know. You can go into the data, and if you don't see that box and you know that you need to check it, try scrolling your tab over on all the way to the right and see if it's there for you. You know, C. difficile is all the way over to the far right, and you know, sometimes you just don't see it, and so that can be a really common mistake. It happened to me. I just couldn't even believe it. I was like, well, how did we miss this? So scroll all the way over to the right of your monitor, and it'll be right there waiting for you to check it. And then you can save. So I want to talk a little bit about some of the data strategies and collecting your data. And the first one I want to talk about is, you know, collect your data at the same time, either every day or every month. This is going to help you get into the routine of data surveillance and really create it and develop it into your workflow. One thing I suggest too is if you're new to infection control and you're like, I just don't have time. And that's totally legit, and I acknowledge you for that. So the way it seems in my life that I seem to get things done is like 10 to 15 minutes at a time. Like that seems to be the only way I get a lot of things done. And so I encourage you maybe to carve out that 10 minutes, 15 minutes every day. Maybe it's in the afternoon when things seem to slow down a little bit. And you're like, okay, from 3:30 to 3:45 every day, I'm going to sit down and I'm going to work on NHSN surveillance. If you're going through the SAMS grid card, you're going to just tackle that task, those 15 minutes every day. And then as you move forward, you can do maybe 15 minutes of training every day, or collecting your surveillance. And then maybe it'll start to grow and expand a little bit more as you have more time. But before you know it, you're going to become an expert, and you'll have become an expert 15 minutes a day. So I really encourage you to do that at the same time every day and every month. Also, align your data submissions with other requirements. So if you have data that you have to enter for MDS or other requirements for your facility, enter in at the same time. Schedule it at the same month. If for the CDI pilot, we definitely encourage the data to be in by the 10th of the following month so that data can be checked and accurately reported. And so maybe you have other requirements that you could also submit at the 10th of that month. And so really encourage you to enter your data at that time. Utilize your electronic health record reports to extract your data. Really see what is available to you to make your job easier. Perhaps some of your reports are already in your electronic health record, and that it can make it easier for you to collect your data. So speaking of collecting data, I was really curious because one of the things that I really aim to do is share best practices across the collaborative, and I really want to know what's working really well for one user, and then share that practice across the entire collaborative, those that are working on enrollment and also surveillance. And so I got curious, I'm a curious bird, and I asked this question to some of our users. I said, so how are you capturing your NHSN data? And if by electronic health record, what reports are used to obtain this data? And then if they were obtained by manual calculation, to explain how that was happening. Because I was getting a lot of questions like, I don't really know where this variable is, and I'm not really sure where to get this. And so I thought, well, let's see if we can get some aggregate data here. So the first question was on the NHSN annual survey, the census variables, and we heard this a lot with the number of short-stay residents and number of long-stay residents, and the data that we saw was just all over the place. We'd get sums of things and averages, and it was just very clear that this data was not entered accurately. And so I asked, where they're getting this data from. And what we found is that the electronic health record contains this data within the facility information, the summary report, and the census report, as well as some manual calculations may be required. The business office and the business and accounting office was often used as well as and they utilized the electronic health record. So this was interesting. I got this and they said PT assists with collecting the average length of stay for short stays. And I said, are they talking about physical therapy, like PT? So I actually asked the user, I'm like, is PT your physical therapy? And it was. So I thought, well, that was a real innovative and creative way to get the average length of stay for the residents. So think outside the box. This data may be collected in areas all the time already, and so start talking to some of the other departments and seeing maybe they're already collecting this data and you don't have to do it. The admission discharge transfer report in the electronic health record was a really big and popular one, so this had a lot of that information. And then one user said that they do calculate manual calculations, and I have a feeling this is probably the norm because it's not always in the electronic health record as just those actual variables, but the length of stay by discharge report, and then they added each line manually. So that definitely, obviously that's going to be more burdensome, but that is a way that you can calculate that as well. For the microbiology laboratory practices, I have to admit I had an ulterior motive for this one. I actually wanted to see if users were talking to their laboratory. And so I asked, how are you getting your laboratory practices for the annual survey? And much to my surprise and happiness, I found that they actually were contacting their diagnostic laboratory to confirm the testing type, and that if they had more than one diagnostic laboratory, sometimes people use two, then they would select the testing type that's most commonly used. And this is the CDC's recommendation as well, so I was happy to see that they were following that guideline and recommendation. And then also sometimes they pull this information directly from the lab reports. The cautionary thing here is you just want to keep in mind, like Dr. Antilla was saying, is that sometimes it may say just toxin or culture, and so then you might think it's the toxigenic culture, and that may not be. So just verify with your laboratory what lab tests they're using to make sure that you're both on the same page. Specimen collection date, we know this is really important because it actually drives the categorization of your C. difficile, whether it's community onset, long-term onset, or the acute transfer long-term care onset. And so we want to make sure that we have this accurate date. So again, many folks found that they were able to obtain it from the electronic health records, the admission documents. The admission documents, it's probably more coming from those that were admitted on C. diff treatments, just keeping that in mind. One user said that they actually utilized the NHSN daily log to keep track of their C. difficile stool testing for monthly reporting, and this was excellent, and I hope everybody can adopt this practice because it truly is going to be your best way of tracking those infections and being able to record for duplicates and really knowing which ones to enter into NHSN and which ones not to. The nurses' notes were commonly used, and then also the lab reports. So as you can tell, this really speaks to the importance of doing your daily surveillance as well, because if you have to run around and collect all this information at the end of the month, it's going to be quite burdensome for you. And then also, what's important too is I've had conversations where somebody will say, well, I think we had a C. diff last month, and I'm like, well, we don't really want to think about it, like we want to know it. So, so it's important to keep those logs. And I know that sometimes in some organizations during the stand-up meetings that they talk about those that have newly acquired C. diff, so that's another way that you can gather that information. If it's not discussed in your stand-up meeting, that may be a way to incorporate that, to talk about it in every stand-up meeting every day, those with newly acquired C. diff. The resident transferred, and we want to know who's coming into the facility, who is, just to protect the other residents as they are, creating risk for your population. Again, this information is found in the electronic health record, the facility activity report, as well as the action summary report. So you can see here that the electronic health record really can be utilized to pull some of this information out. If you don't know what your electronic health record can do, I encourage you to talk to your IT folks and then see what can be done for this, and maybe the reports can be generated for you and created on a monthly basis that can make it easier for you. Maybe they can just hand you the report at the end of every month. So really partner and see what can be done to make your life easier. Also, the face sheet from the discharging facility, this is helpful. It's often placed at the front of the chart, and so this can be used to identify if the resident was transferred in the past 4 weeks. And then also the facility notes from the transferring facility can be used. For CDI monthly summary report, your denominator data, a lot of this comes from your electronic health record as well. The resident admission days can come from the EHR, as well as your daily census by unit and the total census of the building, as well as the action summary report. So all of these are in your electronic health record, depending on which EHR you use. Your business office, again, often has this information. Many users say that they get this information from the business office. Resident days was the same for this, the exact same. So you can tell here it's important to talk to your business office and see if you can get that information. Maybe say to them, look, I have this deadline every month. It's the 10th of every month, and I need the total resident admissions and resident days from the previous month. Do you think we could get this from you at that time? And so really have those conversations. Get them involved in your infection prevention. Why not get everybody involved? And the number of admissions on C. diff treatment. So one user said that they got it that they actually have a log, any residents that are admitted on C. diff and that are tracked in the infection control log. This is excellent. Again, this is discussed in the stand-up meetings as well every day. And then also any new admissions within the last 24 hours appear on a facility activity report along with the medication orders and diagnosis. So that's beneficial for those that are coming in on C. difficile to really know what the medications they're on and the orders are on. That way it helps you to implement your infection control right away with isolation and environmental services, and so you're really on top of that. And then also the admission discharge transfer report from the incoming facility, so that can help you identify that information. Okay, so that was a lot of information about data and surveillance, and I just want to say that there is help for you and support, advice, and guidance. You have a lot of people that are supporting you in this collaborative and that really are ambitious to see it succeed and to really carry it forward. I think, and I've thought throughout this entire project, the National Pilot Project, that everybody has worked so hard in this, and so it is my hope that it continues to move forward and be sustainable. I mean, you don't want to have gone through all this work, getting your SAMS grid card, learning surveillance, and then stop. So I really encourage those that are doing the NHSN surveillance to continue with it, continue moving in your surveillance, expand to other areas like UTI that can then support your antibiotic stewardship programs, and then also the prevention process measures that we've learned about here. And so I really encourage you to expand upon it. It's a ready-made system, and it really has everything you need to have a robust infection control and prevention surveillance within your building. And it meets your federal regulations, too. I just want to say that, too. Some resources and for help, of course, NHSN. We have a great team that is always so willing they're just so supportive, and I love being able to reach out to NHSN and email them, and I've always received such great feedback and collaboration and training, and there's just, I just encourage you to reach out to them, email them with any questions, and then also bookmark this page in NHSN on the web browser. It's excellent resources, and even if you do print, I like to read and write on the paper still, so I'm kind of old school, and I like to print things, I'm sorry, but I like to write on it, and I'm more that hands-on learner. So if you need to do that, that's great, but also don't forget to refer back to the website frequently because information is updated all the time. Any changes that are made are updated, any new material, and plus you're going to want to go back and learn how you can then conduct surveillance for UTI and prevention process measures so that you can continue to move forward with your surveillance. So utilize the tools on here, and then also they have the newsletter is on the website, so I encourage you to bookmark this and go to it frequently. Maybe once a week or once a month, you know, in your 10-minute time slot, you can go and look on the NHSN webpage. So some other trainings available, the QuINQ-IO nursing home training session. I know that the CDC also partnered and put this together, and this is helpful for your leadership as well. So there's 6 modules on exploring antibiotic stewardship and resistance, as well as Clostridium difficile infection, and this can be really beneficial if you're looking maybe to get a little additional support from your leadership. You can maybe suggest them looking at this as well. This training can be utilized throughout your whole facility, and there are continuing education credits that you can receive for this. So I encourage you to go through these modules. They're about an hour and a half each. They're very good. I've gone through this and have really learned a lot. So I encourage you to look at those. AHCA has developed an infection preventionist specialized training for this role. This is really important now that as of 2019, all nursing homes are now required to have an infection prevention role to participate with CMS. And so this is a great specialized training that can support you in that. What I really like about this is that it is a self-paced training, and so it will definitely help you to implement and manage your infection prevention program, and you can really do it at your own pace. You can, I believe you can utilize it up for 9 months, and they'll also give you a certificate for it to show that you're certified in infection control. It's different from APIC, but it is a certification. You will also receive contact hours for this, for your continuing education. And like I said, it's an online self-study program, so really take advantage of this. There is a fee associated with it, and so I know that has been talked about as a barrier, but you know, it's not a huge fee, and it really will support you in this role that is required. So I definitely encourage you to look at this. Also, what was discussed yesterday, the CDC and CMS, right, are putting together a new training program that will be available spring of 2019. And so look for that too, and that is no cost, right? Yeah. So excited to see that resource come out. But this is something you can utilize beforehand if you want to get a jump start on it, and that will support you in your training. And then finally, for some additional training, like I said, Health Services Advisory Group, the QuINQ-IO has created some wonderful YouTube training videos. These videos start with enrollment and can take you all the way through enrollment. So if you have users that haven't enrolled, then you can have them look at these videos. They're short, and they were made that way on purpose because we know how busy you are, and so they're quick. You can watch them on your phone, you can watch them at home, you can pause them and do the step and then move on to the next step. There's training videos on enrollment, setting up your facility, data quality, as well as a new series that came out late last year on doing some basic data analysis in NHSN. You can actually look how to pull reports and to even do your calculate your CDI rates. And so these I encourage you to look at, and of course subscribe to HSAG's website for other great training that are produced. And finally, because I believe in you all, I know you can do it. This work is really great, and I thank you so much for all of your effort and continued work in this. And we'll keep moving it forward. Thank you.
Thank you, Buffy. Are there any questions in the audience for Buffy? Great. All right. Thank you, Buffy.
Thank you.